Welcome back. You are watching DXB Today, and today we are delving into all things menopause and eliminating that fear, a powerful new chapter. Now, our next guest is a consultant obstetrician and gynecologist with 15 years of clinical experience specializing in obstetrics, urogynecology, and menopause care. Welcome, Dr. Sadiya Hussain. Thank you so much.
Thank you so much for having me.
There was a lot of I'm very impressed with myself that I got through
really
that.
well.
Thank you. Well, Dr. Sadiya, we've already talked about, some of the differences between perimenopause and menopause, but I really want you to highlight some of the changes and basically, what do we need to be looking out for? How am I now 41 years old? What should I be looking out for? How do I know that I'm going through perimenopause? What are some of the signs and symptoms?
Yeah, I mean, that's a really tricky one because it can range from everything because there are estrogen receptors everywhere in our body. So it can be things like psychological symptoms, physical symptoms, and other symptoms that can affect your bladder and other things. The first things that people start to realize is a change in their menstrual cycle. Just as Sharon was saying, it can become a little bit more irregular. So those are the first things that you notice. But then it can be things like vasomotor symptoms, and what I mean by that is the hot flushes, the night sweats. But the interesting thing, has that started?
Yes.
Are we diagnosing you today? But also it could be other things, right? But yes, that could be one of those things. But interestingly, with those symptoms, it doesn't affect about 20 to 25% of people. So it's not something that all women will have to go through the change. Then you have the mood symptoms. So I see women who are like yoga teachers, Pilates teachers, that all of a sudden have started getting rage out of nowhere. And that doesn't quite correlate to, the jobs that they're doing. Anxiety is another thing I see, low mood, just not enjoying things like they used to enjoy before. And the physical symptoms can be things like ringing in your ears, it could be muscles and joint pains. So it can be really non-specific, and that's why it's sometimes really, really difficult to diagnose. Yeah.
I think a lot of women as well are confused when they go to their GPs, they get the blood test done, and they come back and they go, I'm normal.
Yes.
So if you want to sort of explain how that happens and why that happens and what options they do after the blood test.
Yeah, absolutely. So the perimenopause, if you are over 45, between 45 to 55, most women will go through, that's the age they go through menopause. Early menopause is between 40 to 45. Premature menopause is anything under the age of 40. Really, for me, it's by symptoms, because what can happen when you're in the perimenopause is that you still have a natural cycle. You are still producing some estrogen. So you will have points where you're fluctuating with your hormones. So if I take your blood test at one time, it might be absolutely normal. Will that necessarily stop me from trying a treatment that might help you and might affect your quality of life in such a positive way? No. Or I might take it when it's down, but it shouldn't change the way I manage you, You can use it when you're a little bit unsure whether you think there might be something else going on. But actually, I think listening to the woman, having a really good discussion, looking at her holistically, that is my number one diagnostic tool rather than blood tests. I think we spend a lot of money doing blood tests that we don't need.
Off camera, we were discussing about menopause and egg freezing. Yeah. Is that something you recommend for most women? Because I always say that when my daughter is 25 years old, I'm going to gift her a voucher to have her eggs froze, just because her pregnancy and her wanting to be a mother or not is entirely on her, because the way society is going, things are not really guaranteed. Relationships, marriage, we see a shift in those patterns. So would you recommend for most people to get their eggs froze? Because in fact, Amy just told me off camera that you can still carry a pregnancy to full term even if you are going through menopause.
Yes, absolutely. I mean, in the UK, I've had women over the age of 60 pregnant, and we look after. So you're absolutely right. You can do that. That's obviously a whole different topic. But the issue of egg freezing, I think it's really difficult, right? Because actually the majority of women don't go through menopause early. We hear about it a lot and we see it a lot on social media. But when you look at the statistics, actually it's only a very small percentage of women that will be affected with the inability to conceive. So it's all about kind of weighing the pros and cons of going through a treatment like that, the psychological and the physical impact on your body, versus the potentially small chance that you might struggle to conceive later on or have enough eggs later on.
Can we talk a little bit about the therapies that are out there if you are going through menopause? For example, HRT, I think that's the one that we probably hear the most about, and there is a lot of fear behind that as well. Could you talk a little bit maybe about the misconceptions when it comes to HRT?
Yes, I mean, it's had a lot of bad press over the years, and as Sharon alluded to earlier, really from a study probably about 23 years ago. So just when around the time I was starting medical school, you know, and it was HRT is bad, it causes, you know, breast cancer, it causes you to have cardiovascular disease, it's a big no-no. So pretty much from that time, they kind of stripped it out of our medical education. You know, it just wasn't taught it. I think there was one lecture, you know, lasted an hour, that's it, that's your menopause training. So it's taken a long time to revisit that study, to look at that study, and to really rebut a lot of the stuff that was said. And actually, when you look at that study now, you can see so many benefits from taking HRT. The bone health is a huge one. You know, the estrogen really, really improves things like your bone density. When that starts to decline, you have a real risk of fractures because you can get a condition called osteoporosis. Your heart health is another one. So we are quite protected from heart disease as women because we've got the estrogen. After the age of 50, it becomes kind of on par with men. So actually, there's this protective things. And if you're looking at women, as I was saying earlier, holistically, then it makes sense to consider HRT. There are other non-hormonal treatments, you know, there are things like cognitive behavioral therapy, there's acupuncture, there's herbal treatments. So all of those things, you know, having an informed decision-making process with your patient, I think, is incredibly important.
Okay, I'm starting to see the light. I'm starting to see the light.
Good.
Thank you. Okay, so looking at this from a more, again, positive perspective, how can women embrace this stage and, I don't want to say look forward to it, but maybe look forward to time after it? What is some advice that you generally give your patients?
Absolutely. I mean, I can see already in, you know, my years of being in this field that there's been such a huge paradigm shift in the way women and the media perceive menopause. You know, it's no longer about trying to just, we're surviving. It's about thriving, you know, and it's about, you know, empowering women to take care of their own health, the preventative stuff, you know, getting your bone scans done, you know, getting your heart checked, you know, being on the right supplements, all of those things, you know. And I think I'm seeing women that are coming into me so informed, you know, and I want to see a lot more than that. And I think things like this and actually talking about it and having these conversations, hopefully we'll start seeing a lot more of it.
That is some great advice. Thank you so much for coming on the show, Dr. Sadiya. I've definitely learned a thing or two today. Thank you. Appreciate your time.
Thank you for having me.